Hi, everybody. It's Dr. Kerry Reller. It is National Diabetes Awareness Month, and I'm here today to bring awareness to diabetes and talk to you about insulin resistance. Most of this is going to pertain to type 2 diabetes, which is the one that is usually developed later in life. I'm not going to discuss as much about type 1 diabetes. That would be too much for this lecture. So what is insulin resistance? So what is insulin? So insulin is a gastrointestinal hormone secreted by the gland called the pancreas, which sits behind your stomach, right there. So what is insulin's job? Insulin's job, the main job, is to reduce the blood sugar. So basically, you eat something and insulin is released from the pancreas to lower our blood sugar or blood glucose after a meal. It helps the muscle cells take up blood sugar. It helps other cells too, but we're going to focus mostly on muscle cells today. It also is a fat storage hormone. It causes fat cells to take up fat and store it for later, for fuel. It also prevents fat cells from releasing fat. That's called lipolysis. It prevents the breakdown of fat. And the other jobs, there are many, but they're kind of beyond the scope of this discussion today. So what is insulin's resistance? Basically, insulin resistance is the impairment of insulin's ability to do its job. So basically, the muscle cells aren't listening to the insulin anymore. So let's talk about basically how glucose gets into cells. So when you eat a meal full of carbs or sugar, it's broken down into blood sugar called glucose. The blood sugar rises, and that signals the pancreas to release and produce insulin. Then insulin's job is to move the blood sugar out of the bloodstream and into the cells of the body, like the muscle cells, where it can be converted to energy or glycogen. So this is a diagram of the insulin cells. You can see here in green, and then insulin receptors in blue, and then red are the glucose cells. So on all of the muscle cell membranes, there are insulin receptors. The insulin and the receptors work like a lock and a key. When they come together, a channel opens and lets the glucose into the cell. When the glucose gets into the cell, then the cell can make it and convert it into energy or glycogen. So insulin resistance is when the insulin receptors are not working properly anymore. So the pancreas has to produce higher levels of insulin for the same amount of sugar that you eat to get the blood glucose back down to normal levels. So you can see the insulin has increased here and the blood sugar is the same. So if you are eating the same amount of sugar and the pancreas is making higher insulin, then you're going to store more fat because it's not going to break down that insulin and convert it or bring it into the cell. So insulin resistance is actually a protective mechanism. It prevents too much glucose from getting into the cell. Otherwise, the cell could, be damaged. And eventually that'll lead to blood insulin levels rising, like I had just said. But then eventually the pancreas can't keep up with everything. So then the blood glucose levels rise, leading to the progression of prediabetes and eventually diabetes. So you can see here, all the red glucose has gotten increased as well. So the results of extra insulin. So what does all this insulin lying around cause? So basically it causes a buildup of fat, especially visceral fat. So now there are two types of fat in the body. There's subcutaneous fat, or the fat right below your skin. That fat isn't dangerous. But the visceral fat, that's the bad fat that's located inside your abdomen and all around the organs. Visceral fat is very dangerous. It's metabolically active, meaning that they produce all different kinds of hormones and other substances that can wreak havoc on your metabolism and your health. Elevated hormones from this visceral fat create certain ones create inflammation, and that inflammation is very dangerous. That's what causes the damage of artery walls, leading to cardiovascular disease, which is the #1 cause of death in America. Cardiovascular disease includes stroke, heart attack, aortic aneurysm, etc. All the inflammation markers can also damage joints, causing arthritis. It can lead to cancer growth. It can damage tissue in the heart, the brain, the kidneys, and the lungs, causing asthma. And it can also hurt the GI tract, causing reflux, otherwise GERD or IBS. Extra insulin also can cause a buildup of fat in the liver, leading to what we call fatty liver disease. Basically, there's an epidemic of fatty liver disease right now. It used to be called alcoholic fatty liver disease, but now non-alcoholic fatty liver disease is kind of taken over, as alcoholic is not as common. This is mostly due to high fructose content in the diet. I'm not going to go into the details, but fructose, unlike glucose, has to be broken down in the liver. Glucose can be taken up by any cells, but fructose is specifically processed in the liver. And that makes things like high fructose corn syrup dangerous to eat because it can lead to fatty liver disease. Extra insulin in the body, like I mentioned earlier, also can decrease satiety. That high level of insulin also goes to the brain, and in the brain, it blocks that hormone called leptin. And leptin is the hormone that signals the brain that you're full when you're eating, that it's time to stop eating and do something else. So if you're blocking leptin, your body isn't going to know when to stop eating. So basically, the hyperinsulinemia, or basically high insulin in the bloodstream, leads to high blood pressure, high cholesterol, altered vascular beds. It can lead to gout, which is hyperuricemia, and basically this, I mentioned before, systemic inflammation and glucose intolerance. So all of those things can lead to type 2 diabetes, cardiovascular disease, fatty liver disease, and something called PCOS, polycystic ovarian syndrome, that I'm not going to go into today. So blood sugar elevations. So basically, you could have perfectly normal blood sugar, but the high elevated insulin is already causing some disease processes. So as insulin resistance progresses, eventually that elevated blood sugar will also go up because the pancreas can't keep up. So one of the things that I do in all of my patients is check a hemoglobin A1C. So the hemoglobin A1C is a 3-month average of a blood sugar reading. Basically, anything under 5.7 is considered normal, but you may have some insulin resistance building up, as we mentioned before. But prediabetes starts at a hemoglobin A1C of 5.7, and diabetes starts at a hemoglobin A1C of 6.5. So we have some criteria that we can use to try to catch insulin resistance earlier and treat it before it becomes prediabetes or diabetes and a bigger problem. About 80% of Americans have at least one of these 5 criteria I'm going to talk about on the next slide. Almost everyone I see has at least 2 of these criteria. Mostly I'm referring to my weight management patients. And 3 criteria are required for a diagnosis of metabolic syndrome. So what is metabolic syndrome? So it's 3 of 5 of these criteria here. So a waist circumference greater than 40 inches for men or 35 inches for women. That's number 1. Number 2 is a systolic blood pressure greater than 130 millimeters of mercury, or a diastolic greater than 85, or the fact that they're on blood pressure medication to bring down the blood pressure. Also, criteria number 3 is a fasting blood glucose greater than 100, or a prediabetes or diabetes medication. Criteria number 4 is triglycerides levels greater than 150, or being on a cholesterol medication that would bring that down. And then criteria number 5 is having an HDL cholesterol less than 40 for men and less than 50 for women. Remember, HDL is that good cholesterol that we want to be high. I did present this in a previous lecture on triglycerides. So metabolic syndrome is diagnosed when you meet 3 of 5 of these criteria. So what is the first line of defense? Basically, to not have insulin resistance and not get prediabetes or diabetes, and to have long-term weight loss, you have to keep your insulin levels low. So how do we do that? Well, I'm going to save that for in detail for another lecture, but basically you want to reduce your flour and sugar intake. So basically carbs and sugar are broken down into glucose. Glucose causes the release of insulin. You want to avoid processed foods, eat foods without labels, aka whole foods, right? Try to shop the perimeter of the grocery store. Not going down those aisles is where all these processed foods are. And then you want to exercise to keep those muscle cells sensitive to insulin so they don't get resistant. And the best medicine in case you are developing prediabetes or insulin resistance is metformin. Metformin works on those cells and helps them become more insulin sensitive. And in turn can help with a little bit of weight loss as well. So that's all I have for you today. These are my references. And if you have any more questions, or if you want to work with me, you can find me at cfma.health or Facebook under Clearwater Family Medicine and Allergy, and Instagram under Clearwater Family Medicine. I hope you enjoyed this discussion today, and stay tuned for next week. Thanks, everybody. Have a good one.